All right, so next point, Lieque, lung 7. So this point is going to be located on the radial aspect of the forearm, so we're working right here. Again, rad. Approximately 1.5 soon proximal to the wrist crease. So who remembers what 1.5 soon looks like? 2 fingers, good job. So you're gonna find the wrist crease. And this is again kind of, you know, we have lots of creases here. But if you just rest your fingers like that, so everyone do the 2 fingers, then slide up, you feel a depression. Does everyone kind of feel that? It's subtle, it's between 2 tendons. I mean, if you keep going, you'll find then the finger rises above the styloid process, which is another wrist bone here. So it really is just, the finger just kind of stops in it. Is everyone getting that? Okay. Another way to find this that's really easy, rather than just 2 fingers find it, is if you take your fingers like this, your hands, you cross them, where your index finger lands is right on that point. And you don't want to do it tight, just a very loose grasp. Everyone getting that? So the top, so yours would be, yes, exactly. And then it would fall right there, perfect. Got that. So that is Lieque, lung 7. This is another command point. This is going to be for the head, neck, and throat. And I didn't put it on there, but it's also really good for the chest and the lungs as well. So again, if you have a sore throat, the first point that we went over is the command point for the face of the mouth. So I think of the first one as this area. I think of this one as everything back here. You can use them together and cover everything. So headache, neck pain or stiffness, sore throat, itchy throat, treats the lungs. So if you have cough or asthma, this is also a really good point, not even from just a lung point of view like a cold, but if you have nervousness or anxiety and you feel that, like that feeling in your chest, that shortness, tightness, this point can also be really good for that as well, to open the area. Again, this is also good for the onset of colds and flus. So if you feel something coming on, you're kind of already in the area. If you find it like this, give Hagu a little stimulation and then move up here. And you can kind of just work, you know, you don't have to just here, just here. So going back to the schools of Tuina, you can just press and hold. You can rub, that's fine. Or you can really get in there. Some of these ones around the wrist are a little harder to get in like that. It might be better, but Hagu you can really stimulate like that. Cautions and contraindications, none for acupressure. There's a lot of vessels that you have to be careful with the needling, but for acupressure you're fine. Deeper isn't always better with the pressure as well. Sometimes we think if you really dig in there, it's going to be better. That's not always the case. Listen to what your body's asking. If you're pressing on it and it feels good to go deeper, probably need that. You can just, in Japanese style acupuncture, the needles just kind of rest on top of the skin. They believe that you can tap into everything very superficially without going deep. So there's lots of schools of thought on that. Just again, tune into what you feel like your body needs at that point.